Okay, so this morning is a typical morning for the peds rotation. Typically, we'll get up about 5 a.m. Our morning huddle starts at 8, so it takes me a little bit to get to the hospital, but normal rotation day, wake up, get to the hospital, get into surgical scrubs, that's what we're required to wear on this floor, meet with the morning huddle, so we're meeting with the OB residents and doctors as well as neonatology and our peds, kind of figure out what's on the schedule for today, whether that's C-sections, whether that's inductions, kind of see where we need to be there during the births and do the APGAR scores on the babies. So peds is it's a little bit different again at every hospital and every rotation. This one's nice because we've been experiencing the clinic side where we're going to see most of our pediatric population and doing sick visits and immunizations and well child visits, but neonatology is a little bit more my stream because we get the excitement of bringing life into the world. So I did my first C-section, which I'll get more experience with and actually be scrubbed in for OB, but it's really cool to be able to see that and be in the same room as all of that good stuff going on. It's a 6-week rotation, so we do have our shelf coming up next week, which I'll let you all know how that goes, but we will be at the hospital soon. I'll take you along, kind of show you my day, how I enter, and all that fun stuff, just so you guys are able to kind of see it firsthand and you're out of my office on some of these videos and you actually follow me around. So I know it's always exciting, and I wish that other people did this when I was searching and seeing how clinical rotations go. So be at the hospital soon.
And I lied, guys. I'm so sorry. This was the moment I realized that I was just not feeling good myself when I got a COVID test, negative. Later in the night when my fever peaked and would not come down, I found out that I had influenza. So I did end up though making another video right here. Okay, and once again, apologize for this. I did have to do a voiceover on this video just because the road noise was absolutely terrible. But basically, I just want to comment on the pediatrics rotation, things that are important that I felt for the upcoming shelf exam, and then just the overall preparedness that at least I took from the hospital that I was at. So I'm going to start with the shelf first. The number one things that stood out to me when I was studying for the shelf and now having passed the pediatric shelf is knowing your vaccine schedule and really knowing the GI issues that come up in the pediatric population, as well as the childhood rashes. And a lot of these things, especially if you listen to Divine Medicine or Divine Intervention and Dr. High Yield, you'll notice a lot of times you can really differentiate these things based on the ages. So when you're studying, really pay attention to the age of the child, when it's presenting, and really hammer down things like volvulus, necrotizing enterocolitis, pyloric stenosis, things like that, to really be able to feel confident when you go and taking the exam. Childhood rashes typically look similar, so really dive into UWorld. They have very good charts, very good pictures to be able to differentiate a lot of those. Just paying attention to the symptoms, the vital sign, how long it's been going on, any immunizations that the child might have, etc. In addition, when you're studying for the shelf exams, actually do really pay attention during your pediatrics rotation as well, because a lot of the things, especially physical exam wise or what are the next best steps, I was able to pull from my pediatric rotation. So again, it's going to depend on a lot of your hospital, but we were more clinic at our hospital. So unfortunately, I didn't really get to experience too much inpatient peds, which I think would have been very beneficial. Even though I'm not a person who's interested in pediatrics, just being able to still have that experience as a medical student, I think would be very important. But our typical day, like I said, was pretty much starting at 6 a.m. If we were in the clinic that day, it was mainly well child visits. We got to see some very cute, like 1-week-olds. So it was really fun to be able to see that. And then we saw all the way up to age 22 in our clinic, I believe. And then we switched over to neonatology, and that was just being able to be around newborn infants. Didn't really do too much on that rotation just because mainly it is more geared towards like OB in our hospital. We don't have a lot of labor and deliveries that come through to our hospital, so it was pretty slowed down on that rotation. And then lastly, we had our family medicine clinic that we'd work at, and the students who were on pediatrics would be able to see the pediatric age patients, and that was just bringing more clinic back to well child visits, sick visits, just checking in on school physicals and things like that. So overall, the pediatrics rotation went well. Again, just remember the things that I said for shelf. You guys will be good to go. If you have specific questions about the pediatrics rotation, please don't hesitate to leave in the comments and drop below. I'm currently already halfway through my general surgery rotation, which is something that I love and I am so excited to talk about because that is what I will be applying to this year. So after we get through that, I will make a video, tell you guys my experience and kind of things to watch for and how to gear yourself up for your general surgery rotation. As always, guys, thank you so much for tuning in. I am so sorry that this video did not make it as well as the other ones. I ended up being too sick throughout my entire pediatrics rotation, but better videos are to come, so stay tuned. Thanks, guys.